Feeling stressed, overwhelmed? It's time to unstress your life and focus on controlling what you can control. I'm Dr. Ron Ehrlich, host of the Unstress Health podcast, inviting you to join the Unstress Health community and discover a holistic approach that helps you more effectively face the daily challenges of our modern world and effectively recover each and every day. Unstress Health is here to provide you with advice and support that is independent of industry and influence, an influence that's easy to miss but difficult to ignore. Our focus is on building mental fitness. Your mind can be your best friend or your worst enemy. Mental fitness is the key. Our three-phase approach targets mindset, boost your positive intelligence quotient, and move from self-sabotage to self-mastery. Secondly, the challenges. We redefine what stress means in our modern world. And thirdly, recovery. Master the 5 pillars of health. As a member of the Unstress Health community, you'll turn obstacles into opportunities with expert-led courses, curated podcasts, personalised health assessments, a supportive community, and much, much more. Join Unstress Health today, and together, let's not just survive, but thrive. Click on the link below or visit unstresshealth.com. Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. Well, today's episode, we explore adaptive medicine. We take a deeper dive into integrative medicine. If you are watching this on YouTube, you can actually go on a tour, an extra bonus at the end of the interview. I take you on a tour of an integrative practice, specifically focused on mitochondrial function, improving mitochondrial function. And that's a topic today as well, not just adaptive medicine, not just integrative medicine, mitochondrial function. We're going to be talking about the light diet that we should all be conscious of, light hygiene, or rather, and particularly checking in with the sun on a regular daily basis and how important that is. We're also going to learn about heteroplasmy. I won't spoil it for you. My guest today is Christabelle Yeoh, and Christabelle has been a guest on the podcast before. She is one of Australia's leading integrative medical practitioners, functional medical practitioners for those listening in the States. Christabelle has literally taught thousands of doctors and health practitioners in Australia and overseas about functional medicine. She's the former president of the Australasian College of Nutritional and Environmental Medicine and is a regular presenter at their conferences, their courses, and many other courses around the world. I hope you enjoy this conversation I had with Dr. Christabelle Yeoh. Welcome back, Christabelle.
Hi, Ron. So happy to be here.
Christabelle, I am a huge fan of your practice. I am a very proud patient of it. And I believe you are setting the standard for how medicine could and should be practiced, not just in Australia, I'm talking globally here. I know you're giving a lot of lectures you've done it to the Australasian College of Nutritional and Environmental Medicine, of which you have been past president. And you also have given a talk to NIM, the National Institute of Integrative Medicine. Your topic is the biophysics of heteroplasmy. And when I looked at that, I thought, gee, I had to look it up. And then even when I looked it up, I didn't quite understand it. But then when you started to explain it before we came on, I thought, don't waste another breath. Explain it to my audience as you will explain it to me. Tell us about why the biophysics of heteroplasmy is something we should all be familiar with.
Thanks, Ron. It is a privilege to talk to you. You've had so many amazing thought leaders and speakers on your podcast, so I'm really happy to be here. And I've been educating on mitochondria for about 10 years. I've been an integrative practitioner almost 20 years. I've been a doctor 25 years. And the beginning was always very much about brain health, neuroinflammation, because I was treating a lot of people with autism, chronic fatigue, chronic infections like tick-borne illnesses, that sort of thing. And it really affects the brain, and you just really have to find the best ways to get your patients well, because I'm and results driven. I'm not a big research person. And then 10 years ago, I was really studying a lot about mitochondria, thanks to Robert Naviaux, who wrote The Cell Danger Response about 12 years ago. And so ever since then, in the last 10 years, it's just this wonderful mitochondrial journey, and I've been educating on it. And in nutritional medicine, we're so familiar with nutrigenomics, epigenetics. We talk about diet, lifestyle. And so now I'm bringing in heteroplasmy because that is the epigenetics of the mitochondria. So the mitochondria are affected by a lot of the things that we already talk about: sleep, exercise, toxicity, nutrient supply. Of course, they're affected by those things, but if we just keep that discussion to basic epigenetics, as it were, we'll miss out on some of the massively important biophysics aspects of the mitochondria. And I just, so my talk is about highlighting the biophysical properties of the mitochondria, and its bioenergetic function is going to be affected by that. So heteroplasmy is basically about the mitochondrial genes. Should I tell you about the mitochondrial genes?
Yes, because I think most people would be familiar with the fact that we have genes in ourselves, and we are not victim to our genes. This is the wonderful science of epigenetics, where we can actually, it's more important how your genes express themselves rather than just be a victim to your genes. And this is empowering. But a lot of people will have heard about mitochondria, that it's all about energy, but they may not be familiar with the fact that they also have their own genetic information. Let's go a
Yeah.
bit back to 101 there and just remind our listener about that.
So 101, but first I will say that, yes, it's all about energy, but it's not about mitochondria making energy. We always hear people say, oh, mitochondria are the powerhouses of the cell, they're making ATP. So I really like to change that language. Mitochondria aren't making energy, they're energy transducers. So they are
Interesting.
capacitors. They
Yes.
store energy.
Uh-huh,
And by
uh-huh.
the way, when they store energy, you will have a lot of energy because it's like your battery is charged up. But they're not there to just produce you energy at the drop of a hat because you want some. It's
Yes.
actually
Yeah.
nature's got all these beautifully built-in mechanisms. And, when we think about nature and we think about evolutionary principles, and I know that you're across all the ancestral health type of thinking, Ron, then we actually go back a bit more to why are the mitochondria doing what they're doing? They're not just making you energy because you need to exercise and work harder. So back to the mitochondrial genes. So the mitochondria have 37 genes, and that pales in comparison to our 22,000 nuclear genes that we have in the DNA. It was probably in the early 1940s and 1950s, mid-1950s, Watson and Crick came out with, the understanding of DNA. It was actually not long after that, in the mid-60s, Mitchell and Mauve came out with understanding that mitochondria have their own DNA as well. And they're circular DNA. And there are 37 of them, 13 of which are the most important genes that code for oxidative phosphorylation, so your energy production. So mitochondrial genes are really all geared towards the bioenergetics of the cell, which is ultimately the survival of the cell. And if you go back further to about 2.5 billion years ago, and that's the endosymbiosis theory, that, our ancestors, well, we really came from, our eukaryotic cells really came from a prokaryote engulfing or ingesting an alpha probacterium. And that was what became a mitochondria. And it was because they knew how to use oxygen and make more energy that then evolution allowed prokaryotic cells to evolve into prokaryotic cells by having these mitochondria inside them.
Let me just stop there because, again, I want to remind our listener you're using the term prokaryotic, which has been around for billions of years, which is really a single cell organism that's just got a cell membrane and it's got genetic material floating around in there and all that. But there was something quite exciting which happened, evolutionarily speaking, I think around 500 million years ago, where the eukaryotic, there was a cell membrane and then the nucleus was enclosed within that cell membrane. And so we had a nucleus that contained the cell. And is that the way we distinguish prokaryotic to eukaryotic? Because then that allowed multicellular organisms to develop.
Yeah.
Okay, good. Okay, got that one. That's good. That's good. So these mitochondria somehow inhabited the prokaryotic primitive single cell organism, or did that happen when it became a eukaryotic one?
That happened when it became a eukaryotic one.
Okay.
And that was 2.5 billion years ago.
Okay.
Yeah, that has been written about by Nick Lane, who is an amazing evolutionary biology geneticist from UCL in London.
Mm-hmm.
And so a few of his books, Power, Sex, and Suicide,
Catchy title.
about the origins of life and mitochondria, and really the basics of origins of life, which is a lot of chemistry, a lot of basics of redox chemistry, particularly. So when I read these papers, I'm not really the best chemist, but it's just so fascinating to think where our ancestry came from, and from an energy perspective, it comes down to redox.
Right.
So when we as nutritional medicine practitioners, everyone's trying to increase their energy, and we're giving them L-carnitine and magnesium and vitamin B5 and coenzyme Q10. And those are all the nutrients that are important in the citric acid cycle, oxidative phosphorylation, and so on. But before nutrient processing, which then can allow ATP synthesis, there's first redox balancing. And redox balancing, reduction, oxidation chemistry is just about protons and electrons. It's a biophysical property. And I know that you've been really getting into quantum biology.
We're going to talk about that. It's interesting, isn't it, Christabelle, that we all studied biochemistry as undergraduates, and we couldn't wait to finish biochemistry so that we never had to worry about it again. In fact, we have to worry about it every single day of our lives. We studied the electron transport chain. We didn't study we did talk about carbohydrate and all that, but we didn't talk about the carbohydrate transport chain or the fat transport chain or the protein. We talked about electrons, which is why biophysics and quantum biology is just so exciting.
It is so exciting, and I wish I was a better physicist.
Yes,
so I could understand it more. But, like I said, I'm just results driven in my practice. And I have a lot of complex presentations, complex patients. And the beauty of it is, at least I don't have to be a real physicist. I just need to know how to put it in practice. And we put it in practice, and we see the results in the patients. And we have come through the last few decades of functional medicine, of course, which I love and I'm fully trained in. And I think that we're just coming to the ceiling of that, to be honest, because people have terrible biophysical health nowadays, and find that like some of them are catching up with a decent diet, and that's becoming much easier in the last decade or so. And a lot of people are popping supplements, but there is a biochemistry ceiling if their biophysical health isn't good. And so what I'm finding is that actually for my patients, they've gone through many, many other doctors. And if I can educate them further on redox, on mitochondrial health as it pertains to our biophysics and all the other components of epigenetics, then we really see results. And it's just I'm so grateful for that and so excited to share this information.
What are some of the lessons, the basic lessons that you teach your patients about those procedures? What are some of the basic lessons everyone should know?
So everyone should know light hygiene.
Light hygiene.
Yeah,
Good.
I don't
Okay,
say
let's
I don't
go.
say sleep hygiene.
Yes.
I
No, we've
say
done enough.
yeah, light
Yeah.
hygiene. Because if you get the light right, and I know for some people they're very sick and it's not as simple as that, but for most people, if you get the light right, the sleep should follow.
Right.
Animals sleep in the dark, at least not nocturnal ones.
Mm-hmm.
And so light hygiene, we do a lot of education about that and changing the light environment in people's homes, offices. Yeah, just light hygiene also refers to what I always say, clock in. So clock in with the sun. So we evolved butt naked, no clothes under the sun. And we literally need to clock in with the various light frequencies through the day to inform our circadian biology. And when our circadian biology and all the amazing photoreceptors, largely through our eyes, but all through our system, get the right information from nature, then a lot of the right biochemical, neuroendocrine, hormonal, metabolic signals will follow. So when we can get that right, then a lot of other things can improve when we tweak food and supplements and so on.
That's what I love about this quantum approach, is it's very accessible, and yet the world we live in is very challenging to that, let alone some of the ridiculous, and I have to call it out for what it is, the ridiculous public health messages we get. I mean, the demonization of the sun is a classic example of that, isn't it?
Yeah, and over COVID, we all had to stay indoors, right? So, like, it is very accessible, but it is also the increasingly industrial environments we live in that do makes it very difficult for some people. Like, some people don't have the space and the countryside to live in to get away from non-native EMF, which is Wi-Fi, 5G, 4G, or all the dense electromagnetic radiation that you would have in the city. But if people have got the right information, they can at least start to build their environment, for their biophysical health. And I think that is also why we're seeing the ceiling of biochemical treatments not going as far as they used to go. When I started practicing environmental medicine 18, 19 years ago, it was so much easier to treat my patients. We get the diet right, we detox them, people would get better. And now it's just such a struggle. And I have no doubt that our mobile devices and the, electrification of our earth is a huge part of warping our biophysical health. And the mitochondria are listening to those signals. They have receptors for frequencies.
Mm-hmm, mm-hmm. Yeah, go on. Yes, I mean, this is the home of the electron transport chain, mitochondria. So this is where the rubber. What do they say? The rubber meets the road. This is where our relationship with light and electrons starts to have its effect.
Yeah, and in the research now, if you look things up like optogenetics, MT switches, mitochondrial switches, the research now is studying very, very specific light frequencies to switch mitochondrial switches up and down to change metabolic outcome. And that's the new pharma, Ron.
Yes, big pharma. Big pharma will just come up with different light frequencies.
It's, it's going to probably be related to chronobiology, and there's a lot of chronobiology research going on at the moment. Chronomedicine, what time you take certain drugs for the best effect, because they're also understanding that there is a circadian rhythm to certain molecules, and the best effects have got certain times. The best time to exercise, which is starting to see that come through on genetic testing panels. The best time to take this, the best time to do that. Of course, the best time to eat is always in the light. So that's the other thing that we educate on. So light hygiene is not just the light environment, clocking in outside with the sun, looking after the light environment indoors. It is also what time you eat. That's part of light hygiene, because the circadian, we've got central clocks. That's photoreceptors in the eye, suprachiasmatic nucleus in the brain, regulating to what time it is through the day as the sun is going through the sky. But we also have peripheral clocks in our body. So that's listening to our food. So if we're eating late at night, we're telling our body clock that it's daytime.
We don't think about that, about the time. I mean, we think through, well, it's often said 3 meals a day, blah, blah, blah. And we've talked about intermittent fasting as well. But interesting to look upon the timing of our eating and actually our supplements and actually any medications according to the chronobiology, the biology of our relationship with light. Go on, I mean, I think it's really interesting you say eat with the light, and that makes sense. What about supplements? There must be a better time to be taking supplements as well, or rather than wolf them all down in the morning and get it over and done with.
Well, I think a lot of people would already intuitively think and know that, like B vitamins are activating because they're stimulating energy, and they just take them in the daytime. And then perhaps magnesium is more for calming, so you take it at night. But I haven't done a deep dive into chronobiology of supplements, and I'm sure that's coming, but I don't think big pharma is sinking money into that, whereas they are sinking money into what time you do your chemotherapy.
Interesting, really. And what are they coming up with?
Just different timings relating to different drugs and different cell types. Yeah. So that's chronomedicine. So I know that they're doing that, but I'm not that interested in that.
So we were talking about chronobiology, and that this is, getting in tune. I love your, light hygiene. What a great evolution, actually, because I used to think that sleep hygiene was the key. But as you say, if we can get that light hygiene right, then sleep hygiene follows. I know in your practice, so I understand the biophysics, well, the biophysics of heteroplasmy, the fact that we need to respect the genetic information in the mitochondria as well as the genetic information inside the cell. We did a program recently with Brett O'Brien, who's working with you at GenBiome there, and we talked about adaptive medicine and hormesis, and that may not be a word that people may be that familiar with. Tell us about hormesis and how that relates to mitochondrial function.
Okay. Perhaps people are not that aware of the word hormesis, but it seems to me everybody is saying longevity.
Okay.
And okay, so if you want to know about longevity, you have to know about hormesis.
Well, everyone aspires to longevity, so I guess everyone should be aspiring to hormesis. Go on. Do go on.
That's right. So really, the fact that our evolutionary biology, which is translated and transduced through our mitochondria, our evolutionary biology allows us to evolve and get stronger, and what doesn't kill you makes you stronger. That happens through hormesis, hormetic pathways, and hormetic pathways are all exercised through metabolic pathways.
Okay.
And I say exercise through metabolic pathways because the one that everybody knows about is exercise. So exercise is a hormetic activity.
Right.
So exercise, we have to push ourselves, we have to make ourselves do things. We might not feel like it. You have to lift that heavier weight and you have to run that bit faster and you're panting away and you want to stop and then later your muscles hurt. So hormesis allows our body to grow stronger, bigger, better, faster, heal injuries, recover from strains and stresses through the metabolic pathways that are challenged by that additional stress. So hormesis is introducing a metabolic stress to our cells, which then allows the adaptation of our cells to become more capable of doing X, Y, Z. So the adaptive medicine, which really came from the Russians, that's the idea that you use hormetic signals, hormetic therapies, give people advice like exercise to stimulate all the right pathways for your metabolism that goes through the mitochondria to get, well, to transduce more energy, we'll just say, to give you more energy, but that's not just because you want to exercise harder and longer. You actually have to recover better. You have to be able to recover well, and then you can get stronger.
And you mentioned exercise, which people know is good for them, but there are other forms of intentionally stressing your body. What are some other examples of that?
So as part of our evolutionary biology, evolving on planet Earth, all the natural stresses that our bodies are exposed to, radiation. So we're exposed to low dose radiation, and that is the sun is also a degree of low dose radiation. And in the hormesis literature, radiation has been studied as a treatment. So in our clinic, we don't do that. But then the next thing is magnetic fields. So on planet Earth, we have a whole range of magnetic fields, and we do need magnetic fields for survival, like you need gravity for your bones. Go to the moon and you'll realize that you get osteoporosis, as our astronauts do, as when they lose gravitational force fields. So gravity and magnetic fields is also a hormetic signal that is necessary for stimulating cells to grow, to be active, to do things. So gravity signals our osteoblasts to build bone density, but you can also use devices that simulate magnetic fields. So a big one is PEMF.
Yes, well,
Pulse electromagnetic fields. So we
yes.
use that as well.
Well, you know, in your clinic, in the part of your clinic, I know it's a branch of your clinic, perhaps, where it's the focus is on this mitochondrial function. It really I visited the clinic, and we probably should at that point cut in for you to take us on a bit of a tour of that, which I will do in this episode. But PEMF, we talked to Professor Victor Marcel Vega on the program, who's also on the board of the Orthomolecular Medicine News Service with myself and 50 other wonderful practitioners. But he introduced me to PEMF just the day that I came to your clinic. I'd never heard of it before. And then you introduced me to it. Just give it to me again. Just explain it again.
So PEMF, pulse electromagnetic fields, and I would say probably a lot of our chiropractic and musculoskeletal colleagues are familiar with this kind of treatment. It's been, I mean, I've used it for 18 years, started using it in our practice in England to treat osteoporosis, and that's a very well-known therapeutic indicator to treat osteoporosis and osteopenia. But it's simply a machine that has got coils in it, and when you run an electrical field through it, or you just turn it on, it produces a magnetic field. And so it produces that magnetic field on your body or on the area that you're going to treat. For example, it's used a lot for athletes who've got joint injuries, and it literally puts magnetic charge into the tissues, into the cells. And so for that reason, it's used to treat injuries that are hard to get to in the cartilage, in bone, in joints, because there's not much blood or no blood flow going there. So that's what a PEMF device is. And there's a lot of different types of PEMF. There's high intensity PEMF and there's low intensity PEMF. And people are still researching what's best for what protocols, how long do you do it for, how often do you do it? And there's just a huge range of biological variation in people. So there's no really fixed protocol, and certainly there's no protocol for PEMF for longevity, but you can see good results with, a tennis elbow after a few days of treatment. So that's we're using it across the spectrum. And at Core Naturopathics, Brett O'Brien, a naturopath there who's been using these protocols for over a decade. In the end, I guess he, like me, we just want to see results. And when you see the results, you bring it into your practice.
And are we thinking that those results are largely due to a stimulation of or an improvement of mitochondrial function?
It's a stimulation of, I would say so, mitochondrial function, but through the hormesis. So it is a stress. So PEMF is a magnetic field stress to the body. So would be a sweet spot for treatment, and that's where that research it's not a one size fits all. So it's not easy to answer a straight question on, or what should I do, how long should I do it for, and so on.
Yep.
But there is a lot of art of the science.
Yep.
So the science shows that magnetic fields do this, and this on cells, on osteoblasts, on fibroblasts, on myoblasts. It stimulates growth, it stimulates growth factors, things like that.
Right.
But in a person, in their whole biological system, you never know exactly where the sweet spot is. But it is a hormetic stress, which then stimulates metabolic pathways to up or down regulate oxidant defense mechanisms as is needed. And then the mitochondrial pathways stimulated there is what helps to bring the additional healing.
Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory Panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. Another aspect to that clinic there is the use of red light therapy. And gee, I remember my mother 40 or 50 years ago having a little lamp that she would use for her hip. But this has become a lot more sophisticated. What is the story there? What are we trying to achieve with, is it red light? Is that what we're focusing on, or infrared light? What is the light therapy?
So now I would think that photomedicine, so light therapy, light in medicine, also being called photobiomodulation, so how light changes biology. And I think now it's moving towards photon biomodulation, so
Mm-hmm.
light photons. So this is a huge body of research now, and I can't really keep up, but people are studying all the different frequencies of light and color. So the most research one is red light. So of course you'll see people can buy their red light panels at home. You can go into like a full, it's like a sun tanning bed, except it's not UV. It's a red light bed. So you can put your entire body in this bed of red light. And all these red light devices usually have red and infrared. And depending on how old the device is and depending on what the various targets are, they may have 2 or 4 chosen wavelengths in that light spectral frequency, in that red frequency. So everyone is trying, right now there's everyone's trying to find the best frequencies for a wide spectrum of things. So in the end, it's how targeted do you need it to be, or how broad spectrum do you need it to be? And the best broad spectrum medicine is go out into the sun.
Yes. How
And
accessible is that? That's
and,
been proven. That's been proven over 4.5 billion years.
yeah. Yeah.
Yeah, big experiment there. Another aspect of hormesis, and certainly in the clinic there too, is cold therapy. Tell us a little bit about that.
Cold therapy, that's the one I probably need to tell you least about, because everybody knows about ice baths and CT cold thermogenesis, and there's just so much metabolic research now how getting cold is so good for your brown adipose tissue, enhances mitobiogenesis, increases glutathione, reduces reactive oxygen species, increases vascularization, like just lots of, yeah, it's on every podcast now doing cold. But in our patient population, we probably do have to be quite careful and go very low and slow. And for some people, cold is not, we don't just apply cold to everyone and everything, although it is a very good thing to move towards. And it also depends where people's mitochondria heritage is from.
Mm-hmm.
Yeah. So our mitochondria come from our mothers.
Right.
And depending on where we evolved, like my mitochondria um, will be different to yours, Ron.
Mm-hmm. Yep.
And how much cold I can tolerate would be different to you, depending on how coupled or uncoupled we are, because of our mitochondrial uncoupling proteins, which means how much non-shivering thermogenesis and shivering thermogenesis we have. So depending on how cold adapted we are, we can lead up to trying to improve that non-shivering thermogenesis, which is the whole idea of cold therapy. So we do have an ice bath at MitoCore, but for my patient population, it's not the first thing everyone's going to jump into.
Yep.
But certainly for exercise recovery, athletes, strong folks, that's extremely good for them, and they really should be doing that.
Mm.
And a very quick ballpark to aim towards is 1 minute per degree you're in. So if
Right.
you're in 5 degrees water, you could work towards 5 minutes. That sounds hell of a lot.
Mm-hmm.
But people should really work up very slowly to that.
Mm. But I guess the most accessible is, of course, turn the cold tap on. Everyone's got access to that, and it's a kind of a very beginner's way of doing that. What would be a sort of if someone was doing that for a minute, 30 seconds, a minute, 2 minutes? What would someone getting started on this be thinking about?
I know that Mark Cohen has got his fantastic, what is it? He loves poems and
Yes, you put your left foot in, your right
yeah,
foot in, you do the hokey pokey, and you turn it all around.
yeah.
Yes, I know. But
And you flip.
yeah, I mean, I used to be very cold averse. I mean, to me, I would not go into the sea if it was under 21. I was very reluctant to go in, and then I kind of surprised myself by doing ice baths for 3 minutes at a time at about 5 degrees. And I felt so good after it, that it's really changed my whole approach to cold. But most people are cold averse psychologically, at least. But then, entering into it has such benefits.
And that is called psychophysical resilience.
Right.
So when you are physically more able to handle a hormetic stress, which is what
Mm-hmm.
cold is, psychologically, it's a huge boost. Um, and so that is, you said Avni Sally was talking about just your attitude and being, having that kind of mental attitude.
Yes.
But some people aren't naturally there, so you have to train it.
Mm.
And you don't necessarily have to train it by going to talk to a psychologist or doing positive affirmations or something. You can train your psychological positivity by getting your physical body a bit stronger. So when you put your physical body through a little bit of strain and stress, as we're talking about hormesis, cold, get hungry, fast a bit, get hot, get uncomfortable, just sprint for 50 meters on your short walk. Just all these little things to push yourself. That is how we get psychologically more resilient too. And then we'll have that great attitude that Avni Sally is talking about.
Mm. No, I would definitely agree that the cold has made a big difference to me and my whole mood. On a more broader basis here, because modern medicine has a very reductionist approach to disease. You're depressed, have an antidepressant. You're inflamed, have an anti-inflammatory. Infection, antibiotic. Anti. And when you ask your doctor, why did I get bowel cancer? They will say, it's just bad luck, genes is bad. But actually, a different approach is this metabolic approach, a more holistic approach. Is that really, isn't it? It's just to say, well, the way it manifests itself happens to be that way in you, but what we need to focus on is this. Is this the ultimate in holistic approach to healthcare?
So, yeah, for sure, we like being proactive. And of course, if people want longevity and good health, they have to be proactive in the world today because we're swimming upstream against the density of EMF, the toxins in our food, the glyphosate, even in our organic food, all of that, right? And so when I educate on mitochondrial epigenetics, it covers all the normal epigenetic things, as I said, that we know about: nutrient supply, uh, avoiding toxins, detoxing your body, sleeping well, and so on. It's just really adding that extra oomph on using nature, using the biophysics of nature, which is what drives the evolution of life, which drives our whole biology. So it's just adding a little bit to that whole story, as you said, being more proactive.
Hmm. But you as a doctor, you see, this is what also fascinates me is that so many doctors, unfortunately, don't practice medicine this way. They actually practice it in a very prescription focused way. And I'm just intrigued as to the effect this has on a doctor's attitude to life, let alone their work. I mean, your approach to work is very empowering, I've always felt, very exciting, very, how do you see those differences? Because we've both been involved in the College of Nutritional Environmental Medicine, and we think, why isn't everybody doing this? Why isn't everybody doing this, Christabelle? This form of medicine?
So I think that first of all, we weren't taught the right information at the beginning. So that is a huge reason for one of the big fallouts, because we're not taught it at the beginning, and then we have to jump in to being a junior doctor, and then you're so busy, and then perhaps, you know, if you're a woman, you're going to have babies, and if you just got a huge training program to go through 5, 10 years, and then suddenly you've got a lot of bills to pay and debts and a family to feed, and then you just keep going on that job. So I think a lot of doctors don't get a chance to step outside of what they were taught, which was incomplete. And then they're just having to keep up. And they're the ones that are having huge burnout and not going so well. And when those people are fortunate enough to have a bit of headspace, perhaps financial space, or their eyes open because of a personal experience, which is usually the case, or a family experience, or curious enough that when a patient says, oh, you know what, I did this and this happened, and then they go and investigate. So hopefully all those little strokes of fortune do occur and people look for more. And as you and I have seen, as soon as practitioners like us look for more, then the door just opens to, it's so rewarding. You get the results you want for your patients. You learn the information you need for yourself. You put it all in place for your family. And then we're all here to live lives as fully as we can for ourselves and our communities, and that's it. So once your own health is better and your family's health is better, and then your professional practice is better, I mean, that seems to me a good antidote for burnout.
Mm. Yes, and we have done quite a few programs on burnout in medical practitioners. The rather sobering statistic is that 44% of medical practitioners and 60% of nurses suffer from burnout. That's characterized by the acronym DIE, disengaged, ineffective, feeling disengaged, feeling ineffective, and feeling exhausted. And that's from people that are delivering our healthcare system.
And what I find sad is that that's not because they're not trying hard enough,
Oh
and
no.
not because they don't have the right technologies and the right medicines. It's actually because they don't have good bioenergetics in their own cells and their own capacity to run as hard as they have to and deliver as much as they, as demanded of them. I think it's just their own physical health or their own biophysical health. If we all had much better physical and biophysical health, we would do a lot more,
Yeah. I mean,
basically.
yeah, this is what I think is possibly the key to improving public health, and that is improving practitioner health.
Yeah, yeah. And sometimes it's really very challenging because of the environments people are working in. Look at a surgeon or an anesthetist or nurses. They're all working in artificial light, indoors, no natural light. And I think of light as nutrition. You know, junk light is junk food. So
Mhm.
we all know we can't exist on junk food. And now when we've got so many biophysical challenges with EMF, EMR, and so on, all the more we need good light as strong nutrition, like get rid of your junk light.
Mm. Well, if you were going to leave our listener with, two or three pearls of, I need more energy. I just need to embrace this approach to the biophysics, to the hormesis, to my mitochondria. What would be your two or three top tips for our listener to leave us with?
I've said it already, and I'll say it again because I'm just so surprised at how when people do this, things just change, which is change your lighting indoors. And I mentioned about, well, not just the epigenetics of the mitochondria, but it's our mitochondria are transducers. So what that means is they're feeling your environment. It's such a felt sense. It's not just what you're thinking, it's a feeling. So the felt sense, whether that's neuroception or interoception, or it's a whole sensory motor experience, the mitochondria is interpreting all those signals. And what I've found is that when people change their light, they just feel different. And so when they already feel different, then they're like looking at their food. Oh, I feel like eating differently. oh, now I feel like moving my body. It just seems to be one of those things that opens the door to other things. So I've just been really fascinated by seeing that in our patient community in the last couple of years. And because we've been running retreats for the last couple of years, then, for 4 days, we have people immersed in the right light environment. We're watching the sunrise. We're eating when the sun is up. And we're doing a lot of other activities like going in the cold and grounding and so on. But the whole kind of mind frame of people shifts. And I think that the right sensory input just makes a much bigger difference than, let's say, just swallowing something or thinking about something. It's such a psychosomatic body that we are in. And I love this new field as well, Ron. This is a new one for you. Maybe you might know this already, mitochondrial psychobiology.
Go on. No, I love it. Go on, go on, go on, go on. Mitochondrial psychobiology. Now, I have heard of psychoimmuno, psycho neuroimmunology, psychoneuroimmunology, but
Yeah.
give it to me again. Give it to me again.
So mitochondrial psychobiology.
Mitochondrial psychobiology.
So
Okay.
it's mind mito or mito mind. So how your mitochondria changes your mind, makes your mind different, makes your psychology different. Of course, it makes your biology different. So psychobiology, and the top lab that's leading this is Martin Pickard's lab. Martin Pickard. And Martin Pickard was Doug Wallace's PhD student. So Doug Wallace is the mitochondrial grandfather. So
Yeah.
he discovered that mitochondrial are of maternal inheritance in around 1980s.
Yep.
Yeah.
Yep.
And Doug Wallace and Martin Pickard are still publishing a lot today about how mitochondria really are behind all of, they call it common complex diseases. It's like they're common and maybe they shouldn't be that complicated, but clearly medicine hasn't fixed anything. And we're under this huge burden of common diseases like metabolic syndrome, diabetes, heart disease, hypertension, and so on. And so, in fact, they appear to be very complex because we haven't fixed anything, have we? And so that mitochondria are behind all of these common complex diseases, dementia, all those things. So mitochondrial psychobiology, and I dare say if we could get our bioenergetics right, that would, what can I say? It would look after all of us.
Well, Christabelle, I want to thank you for joining us today. Not just for joining us today, but for shining a light on us and all the stuff that you do in the profession, in training and teaching, which you've done for many, many years. And you're setting the bar very high for what a medical practice can, could, and should look like. So thank you so much for everything and joining us today.
Thank you, Ron. It's my pleasure.
Well, as I mentioned, I also had the opportunity. I do think that Christabelle's practice sets the bar very high for how medicine could and I believe should be practiced in Australia and certainly globally. A focus on health, a focus on adaptive medicine, a focus on restoring optimal function to fight the causes of disease rather than just fill out prescription pads to manage it. So I went on a tour of Christabelle's practice, a part of her practice, which she collaborates with naturopaths that I've spoken to. Naturopath Brett O'Brien was on the podcast in the last week or so, and they have a practice called Mitocore, which they collaborate with together here in Sydney. And I went on a tour, and I hope you enjoy this tour, which gives you a little bit of an insight into some of the ways of tapping into mitochondrial function therapeutically. Firstly, Christabelle, tell me Mitocore. We're going to talk about that, but what have we got here?
Well, first, mitocore, so mito, of course, mitochondria. And core is because this is a project that has been envisioned with a couple of collaborators, Brett O'Brien and Darren Cecil, who are from Core Naturopathics in Wollongong. They're naturopaths that have been doing this for some time, and I've been talking to them about this, and they do a very naturopathic approach of wellness, and foundational health, and so do I from a mitochondrial perspective, and I could just see how it went perfectly together. So what we have here is a suite of devices for, I like to say it's for mitochondrial health. Ultimately, it's for cellular health, whatever condition one has. It's not to treat the disease, but it's improve health from the foundations of the cell up.
Yeah.
And from, of course, it's nutrition, diet, lifestyle. And a lot of people are, coming to party with that and doing good efforts with that. But we also see a lot of people, not just in the chronic disease community, but a lot of people somehow struggle to get through to that next level of super performance, or even up-leveling a bit of performance. And I think that's really because in the modern world today, in the way we live our lives and all of the things that we're exposed to, which are stresses in our body, particularly EMR, EMF, and bad light, artificial lighting. So we all have a degree of this kind of biophysics mismatch in our mitochondria. So this suite of devices are very much biophysics in thinking and how I like to do things, but also just bringing together some other aspects of what the mitochondria want to do. They want a little bit of hormetic stress, and then they want to adapt and get stronger. So that might be cold, that's hot, that's a bit of fasting. So all of those stresses.
Exercise is a
best hormetic stress.
Yeah.
And then hypoxia is a hormetic stress.
Right.
And hyperoxia is as well. So hyperbaric oxygen, hyperoxia.
Which is what we're standing in front of.
Which is what this device is. This is the OxyRevo.
But I think a lot of conditions are now being viewed as a metabolic condition, cancer, heart disease, everything. And that is about mitochondrial function.
It is.
Yeah.
It is. It is about mitochondrial health and its capacity to adapt to the environment, because we are adaptive beings, and it's all those signals are being transduced through the mitochondria, which is the topic of my talk at the Acronym Conference in 3 weeks' time.
Okay, well, that'll be in
You're
July.
getting a sneak peek.
Yes, I am. But listen, just walk us through some of these devices very quickly, just to give us an overview, because I know we're going to be talking about them more through, go into a bit more detail about them. But what we're standing here. Okay.
So hyperbaric oxygen, and I think everybody knows what.
Well, I don't think everybody does. No, I don't. I think we should assume that.
Hyperbaric oxygen. So this is a hard shell chamber that will slowly pressurize the air in the chamber to 2 atmospheres. So that's like you are diving deep, and you have to keep equalizing as you go down. And this can bring us up to 2 atmospheres, which means it's increasing a lot of oxygen going into the body. And it's not as simple as just, more oxygen is better, because we all know oxygen is a double-edged sword, it's oxidative. But again, I mentioned about how both hyperoxia and hypoxia are hormetic stresses. So when you stress the body and you're changing its environmental signals, then the redox system, the redox metabolism, and all its systems of upregulating and downregulating will change accordingly to deal with the environmental change.
So the hyperbaric. So increasing the oxygen saturation.
Yes.
Yeah. Hypobaric, how do we do that?
There's no hypobaric, but there's intermittent hypoxic training. Follow me.
Okay.
So that is with an IHT device. Some people now call it IHHT because the newer devices have hypoxia as well as hyperoxia. And that's this machine here, which I didn't prepare for you earlier.
That's right.
So this is the Reoxy IHHT. So it delivers hypoxia, which is reducing the oxygen that you inhale through a very tight mask. And the normal oxygen that we breathe is 21%, and it reduces it to 12, 13%. And then it's monitoring you on a SATS machine to know how much you have desaturated when it's given you such little oxygen.
So this is a pulse oximeter, which is pretty common.
Yeah.
And I know if we ever see a pulse oximeter go below 92, we would normally be concerned by that. But how low does this go when we do
to about 80, 81.
Okay, and this is an intentional hormetic stress.
This is an intentional, pulsed, monitored with biofeedback hormetic stress to reduce the amount of oxygen you breathe. It's the same idea as all the athletes who do altitude training, running in the mountains in less oxygen, because your body's got multiple systems to upregulate its ability to deliver oxygen, improving the Bohr curve, the affinity to oxygen, delivering it to tissues and so on. So if you give it the signal that we don't have a lot of oxygen around, it's going to upregulate to be able to cope with that.
How long are we on this?
So this is a training device which is literally training. Like if you exercise and you expect to go stronger, you can't do it in 2-3 sessions. So these training devices, usually people will do 20, 30 sessions over a period of time gradually, and then usually you'll see a decent result even within a few sessions of training if one is already metabolically quite fit.
For how long each session?
Each session is 30 to 45 minutes.
And it's the same with the hyperbaric?
Hyperbaric is often an hour.
Right. Mm-hmm. Yeah. Okay, cool.
Yeah.
Yeah.
So that is your hypoxia and hyperoxia.
Yep.
So the next one is magnetic field stress, also known as PEMF, pulse electromagnetic fields. So we have 2 PEMF devices here. This one is called a Hugo PEMF, which is a very high intensity magnetic field that is generated in coils here. This is like they call it a sandwich. This particular brand has got this. Most other brands don't have the sandwich, which just means you can lie on the bed and have one coil on top of you, one coil below you, and then that is generating a magnetic field. So magnetic field, that's magnetism. Magnetism is what the Earth has, is what gravity is. It's the thing that an astronaut would lose if they travel to space, and that would be the reason they develop osteoporosis. Mm-hmm. So this sort of technology has been around actually for a long time, even not necessarily known to medical. But for example, NASA did a lot of work on this because they needed to address the osteoporosis their astronauts would have leaving Earth and having the loss of a magnetic field. So magnetic field generates a force which our body, our cells respond to. And that's why exercise and all this vertical axis activity is important. Weight-bearing activity is important for the axial load of the bones of the spine. And that's really what, we need to do to have strong bones. But this is basically a version of a therapeutic magnetic field device. Mm-hmm. And it can be applied to joints, it can be applied to areas of the body, which is how a lot of musculoskeletal practitioners, especially chiropractors, they've known about all of this for decades. And that's how a lot of chiropractors will use these devices, because they'll come as other pads or rings that you can put on joint spaces, and very good for putting literally energy into tissue compartments that need the energy or need the help.
We were talking about cellular energy, currents, or body's a battery charge.
Yeah.
And is this part of that, addressing that?
This is part of that. So this is like you charge up the cells, sort of, but literally it is like that, like you charge up your mobile phone when your battery goes flat. So this PEMF is a charge, and it can be applied to particular parts of the body.
Because ideally our cellular charge should be? Negative. I think we had Professor Victor Marcel Vega talking about minus 70 millivolts? Millivolts.
Yes, millivolts. There's a very good
70.
book called Healing is Voltage.
Right.
And that describes it all very well.
And when that charge alters, we start to see problems.
It's when the charge alters, it's also that when the cell can't hold the charge. And this is ultimately coming down to what we call the biophysics of health. So it's not just about biochemical molecules and what we eat and vitamins and minerals. It's really about the biophysical properties that they carry. So light, sound, magnetic fields and frequencies, which are biophysical forces. I wish I was much better at physics when I was back in school, but that's...
But when we studied biochemistry in medical or dental school, we studied the electron transport chain as a way of producing ATP.
Yeah.
We didn't study the carbohydrate or the protein or the fat transport chain, although we did learn what happened to those.
Yes.
But ultimately, it's electron transports that gives us energy.
Yes, and why does the electron transport work? It's because the mitochondria is separating charge. So you know your classic old batteries full of water. Water separates charge, and then your battery works. Positive, negative, charge separation. So the mitochondria's function is to separate charge. It puts the protons there and the electrons there, and it separates the charge. And it's only when the protons move through the ATPase to then spin the ATPase and drive electrons through the transport chain. That's then what a biophysical force of energy then creates a biochemical ATP.
Yeah. I know. I used to think sleep and breathe were foundational, but now I realise physics is.
It sure is. Yes, that's how I see the world too, Ron. So
PEMF, yeah.
There's PEMF, and then we have a second PEMF here. This is another type of PEMF that have got the coils in the mat. And we can also have pads for joint areas if we have a joint problem, But what's special about this PEMF is it's a Swiss device called the IMRS. It's also a brain retraining system. So the brain retraining system is much more about neuroregulation. So the PEMF is going in the background. And actually this mat also has infrared. So nowadays all these devices like to be stacked. So we've got PEMF, we've got infrared, and then we've got a brain retraining system which is using light through the eyes with goggles. Sound. So we have photic stimulation, we have auditory stimulation with binaural frequencies and specially programmed light frequencies, and then it's monitoring your heart rate variability.
Interesting.
So what we're getting a reading is how well your autonomic response is going to the therapy. And we can choose a number of different programs, but ultimately it is neuroregulation more on that sympathetic, parasympathetic, autonomic response. We're trying to effect a change there, but it's also got PEMF and infrared.
And when we talk about heart rate variability, the higher the variability, the more responsive your system is to stress.
To be able to adapt.
Yes.
Yeah.
So if you had 60 beats a minute and every beat was a second, that would be a low heart rate variability.
Yeah.
But if it varied by milliseconds either side of one, it would be a better result.
Yeah.
Yeah, cool.
Yeah, that's right. So that's that. The next thing, as part of the whole circuit of treatment, is the HOCAT.
Wow.
So this is the HOCAT, which is an ozone steam sauna machine. And this is a seriously stacked machine.
Yep.
So this is really fun. So it's steam to get you really hot. So you sit in the chamber, and then an ozone gas blows in. And so the person is sitting here with their head hanging out, but it's sealed around the neck, because one thing you don't do with ozone is inhale it. So they're sealed there, and then their body is being heated up, and then we're monitoring their heart rate
Again.
And then we also measure their temperature as we go through the therapy because it is a hypothermia stress.
Hyperthermia.
So, so like very naturopathic thinking, it's fever therapy. Yeah. And usually people do get a slight fever from this. They may go from 36 to 37.8. Some people even go to 38.
Because we tend to demonize fever, but the body has a fever for a reason, doesn't it?
Yes. So once you have a fever and that temperature goes up, you start to do a lot of autophagy. You start to eat up, dead proteins, misfolded proteins, dead cells, and you're basically clearing up the rubbish. So autophagy is really important. So this device is a sauna, a sweat, of course, sweat with the detox, and then the fever treatment. And inside there's also light. So that's for the biomodulation going on in there at the same time. And then the final thing is frequency-specific microcurrent as well.
Right.
So microcurrent is a different
Because I noticed this chart here with various...
Yes. So frequency-specific microcurrent, that's slightly akin to Rife and Raymond Rife and a whole host of people who then started to develop databases of microcurrent frequencies, understanding that pathogens, many things in biology, systems, disease states, people were having different microcurrent readings. And this is definitely not an accepted thing in conventional medicine, but some interesting results. So people hold the conducting rods whilst they're in the sauna, and they've got microcurrent going through to stimulate a particular signal that you want to stimulate. And then they're also breathing oxygen whilst they're in here. So Ron, you are about to try this and you can give us your verdict.
Okay, no, I'll give you feedback on that. We're going to be reviewing all of this, don't worry. So,
okay, next thing. Next thing is the G-Force Hypervibe machine. This is this is like a simple, very simple gym device. Everybody's probably seen it at the gym. I'll see if I know how to turn it on. And basically it's just vibration. It's simply vibration. And this is much more of a mechanical. So far we've been talking very much about biophysical in terms of movement, magnetic fields and movement. And this one is just physical. So nothing too special, but we always love to move the lymph.
Yeah, because actually rebounders were very much about lymphatic drainage, weren't they?
Yes, exactly.
And actually, I believe with kids, very good way of stimulating parasympathetic activity with kids, putting them on. There we go.
Yeah, so look, it's just, and then we can make it go a bit higher. And it's literally just...
How long would we be on something like that for?
We do this for 10 minutes before we go in the Hocat.
And how long are we in the Hocat for?
Half an hour.
Half an hour, okay. All right, wow, okay, cool.
Okay. So that is the stack that we like to go through. And then in addition, for some people who want to do it and are strong enough to do it, because if we have a chronic fatigue patient, we will alter the stack accordingly. But we have an ice bath.
Yes, cold.
We know you're very good at that one, Ron. You're much better than I am.
Well, I've got what's called the dope at home, and that's referring not to the owner, but more the dopamine that is said to be got from the cold thermogenesis. What temperature do you normally put? Would you have that water at? So
for someone who's not already seriously cold adapted, we might just keep it at 12. 12, 15, that's already difficult for quite a lot of people. But a very good CT, cold thermogenesis protocol to slowly adapt to would be 1 minute per degree. So if you've got a 10-degree bath at home, Ron, you should be doing 10 minutes. Yeah,
okay. Well, I do it at 8 degrees.
So 8 minutes.
I do that. Well, 6 minutes. I do it at 6 minutes, but I'll up it. But actually, after the first minute, it's not as bad as you think.
Painful as the
but it's true that Annie, my wife, prefers it at 12 because she's less adapted to that.
So you go first, and by the time she gets in...
No, I've actually had to turn it up a little bit, so I'm cheating. I'm using her as an excuse.
And then we have, of course, you can't not have photobiomodulation.
Yes.
So we have a great red light panel here.
Yes, okay.
And we chose this panel because we like the comfort of lying on a bed.
Yes.
Rather than in one of those coffins.
Yes.
In a sandwich.
Which a lot of these devices are literally sandwiches of a panel above and a panel below, and you lie on the panel below.
Yeah.
And yes, I can see that would be a lot more comfortable.
Yeah. Yeah. And
how long would we be on that?
If people have got enough time, 30 minutes is a good time.
Mm-hmm, mm-hmm.
Yeah, otherwise I would do 20 minutes as a minimum. Yeah.
So biophotomodulation used to be called low energy laser therapy. Well, that was more specific.
Yeah.
But this is a more whole body thing. That's infrared, is it?
So that's red and infrared.
Red and infrared.
Yeah.
Okay.
Yeah.
Cool. All right.
Okay. So that I've showed you.
Is that it?
All twice, I would
terrific.
say.
Thank you. Well, that was quite an episode. If you're still with me, I would also encourage you to join our Unstress Health community. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness. From self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.